Hello everyone, it's Dr. Jameson Mercier and you're watching 3 Minute Therapy. And today we're going to take a look at a couple things wrapped into one, actually three things. Loss and grief and depression, how the three connect. We use them interchangeably and sometimes we kind of get them turned around. In the next 3 minutes I'll try to just give you some clarity on that. Loss and grief. First thing, loss. And most of us, we know loss. You lose someone, a close family member, a friend, even perhaps a pet, your dog or your cat. That can create some grief, sadness. The sadness that you feel after a loss is actually quite common. That is actually normal. The kind of loss that's a little bit confusing or ambiguous, we like to say, is when you lose, let's say, a job or maybe a relationship. The grief that you feel from losing a job or a divorce or even a bad breakup. Can I get a witness? Right? Those things can be confusing but just as sad, right? Because it almost doesn't make sense as to why we're grieving so much or why we're so sad. But let me tell you, it doesn't matter whether it's a person or a job or your pet or your relationship. There is a space that's left, and that is where the grief sets in. Okay? And so depending on your grief and how you're coping with it, depression, okay, hear me now, depression is also oftentimes common. And depression, to simply put it, can just be just a step beyond feeling sad, right? You're down, not quite feeling yourself. It's okay to feel depressed at times within certain limits, right? And I'll get to that in a sec. In certain situations, if you actually don't feel sad or feel a little depressed, that is cause for concern. For example, if you lost a baby, or you lost your mother, your father, and there's a lack of affect or lack of emotion, people would raise an eyebrow. So duration and intensity is what we look at when we're talking about depression. How long have you been sad? And how deep is the sadness? Are we talking about feeling sad for a couple days, even up to a week sometimes, depending on what's going on? It's fine. Are we talking about months? Right? Are we talking years even, right? For some people that is the case. And how is all of this impacting your functioning? Have you stopped eating? Trust me, we don't want depression as a diet. We need to eat, we gotta drink. Are you able to go to work? Has it been a week and you haven't taken a shower? Hello. These are signs that the depression may be getting to a point where it's a problem, and we may want to check in with a counselor, your pastor, somebody, right? Because that's when you begin to go down this very, very slippery slope. All right? So loss leads to grief and sometimes depression, which is okay, but we just want to make sure we're watching for some signs that could lead us down some very, very slippery slopes. This is Dr. Mercier from Mercier Wellness and Consulting, and this has been 3 Minute Therapy. Take care of yourselves, and I will catch up with you on the next one. Peace.